I'm Hannah and I'm the IWMD nurse specialist for Leeds and Manchester, and I'll let Jade introduce herself.
And I'm Jade, so I'm the service coordinator for both Leeds and Manchester. So I deal with a lot of the admin related bits and speaking to families, booking appointments and organisation in general. But we'll move on.
So what we'd just like to explain today, we appreciate that you've had lots of sciencey talks from doctors. We're not doctors and we don't do this very often, so we'll try our best, but we want to just explain a little bit about our role, how we fit into the IWMD service, how we can help, and really how we work together to support you out in the community. So the practical aspects of the children's nurse, really the definition is to ensure that all children, young people and adults have access to the IWMD service and that they receive a high level of evidence-based care. The care should be individualised, holistic and collaborative, working together as a team. I'm a point of contact for families and work closely with the lead consultants and your local teams. So really what the job looked like 2 years ago when I started was very, very different to how it's evolved, and actually listening to people this weekend has actually shown what the role should be for you to find it beneficial. But I think the main things are to ensure that you receive sort of support out, you get that diagnosis, what happens next, that's what I'm here for. To ensure I can help with appropriate equipment. Have you had, a referral? Do you have everything that you need? Support in schools with the HCP, so I can help with supporting letters, going into school for those meetings and just being a voice for you, an advocate. You have access to the IWMD clinics, and if you don't have an appointment with your consultant, you can contact me in between. Emotional support for the child and family, so we always refer our families to Alex TLC in the first instance, and we work very, very closely with Karen, and with your permission, we discuss families, don't we, and work together. But we also are very lucky to have a psychologist who we can refer families to if you feel that that would be beneficial for you as a family. We attend MDTs and appointments and link with your local team. So I attend lots of local appointments with families because often what I hear is when you get in the room to have to go back and repeat everything is a real burden and a real stress that you don't want to have to do. So I can be the link between the IWMD service and your local teams as well. And school and nursery visits, I always love going into schools and nurseries and sort of seeing how things are going, how you're getting on, and just to make sure that your child is well supported. I'll let Jade speak now.
So like Hannah said, we work very closely together, where as well as being just down the corridor from each other, we're very much back and forth in communication all the time about how we can best provide support for our patients. So I'm often a first point of contact for families, and people will ring me up and they'll come to me with concerns or problems or something new that's happening for them. And so I'll try and field that and try and work out, where do I take this and who's best for that? And often that's Hannah as a first point of contact, because what we see in clinic, and there's lots of discussions around tone and management and sleep and all of those really tricky things. But Hannah's very good at just doing, how do we live life and how do I support you when you're at home outside of all of that? How do I help your child be happy in school? How do I help the school support my child? So we have lots of back and forth there. I also work very closely with a lot of, sorry, bear with me. I can't read two screens at once, so I'm struggling just a little. So as well as Hannah and I's back and forth, we also both attend the MDT. It's my job to keep track of all referrals that come into the service and make sure that everything is ready for that MDT discussion. We have all the information we need and that MDT discussion is captured and actioned appropriately. And really, a big part of my role is communication with the whole White Matter team and making sure that everybody's singing from the same hymn sheet, everybody's on the same page, and we're all working as collaboratively together as that we can. So in amongst all of the bits of the fun bits where I get to go sit in clinic and meet families and build that relationship and speak to people, I also do the admin side of things, that be booking all clinical activity, managing waiting lists, making sure that nobody slips through the net and we're seeing people when we should be. I also collect all data on our patients, track diagnoses, submit all of the boring bits of annual data and monthly data that we're required to submit, make sure that we're on top of genetic testing. I have a big relationship with a lot of the labs around the country, which feels like a really strange thing to be excited about. But when you've got a family and they've come to clinic and they've had genetic testing done, I really want to make sure that Lydia and Hannah and families get those results as soon as possible. So for me, being that bridge between the lab and us as a team really means that we can sometimes get results just a little bit quicker by me pestering and just saying what's happening with this and being able to make sure we're all on the same page and we all have information as soon as we can do. You've heard lots about registry today, so I won't harp on about registry again because we've done lots of that this weekend already, but as part of my role I do the registry data entry and submission, which is then overseen by Deepak and Lydia. Which brings us on to Hannah's wonderful patient passport.
So something we are really proud of is the patient passport, which we trialled last year and then took it through our governance and it got approved. So we've now rolled it out across the whole of the North Service with aims to roll it out across the whole of the UK service. So this is really a two-sided document, very, very short, that can be used alongside a hospital passport if you've got it. It doesn't replace it. And it's just about your child's condition, how it affects you, day-to-day life, how it affects you as a family, and very, very individualised. We do it together, so we fill it out together. So everything that's on there is your views, how you feel your child is. So we're really, really proud of it, and the feedback we've had has been really, really good. You know, families have been taking it into schools, they've been showing other family members, again, just so that you don't have to keep repeating it again. And it's in nice, because I've written it very easy to understand words. It's not sort of difficult, it's nice. And the plan is for you to be able to show it to, you know, anybody who's involved in your child's care, really. So we have lots of plans for the future of the nursing service, and we do appreciate that Leeds and Manchester work very differently with the rest of the UK, and it may be that you don't have that much input really with your nurse, but we are hoping that that will change over time. And the plans from today are that I will meet up with the other nurses. We do have a group and we do meet up, and I'll feed back concerns that we spoke about yesterday and see really how we can work together to make it a service that is just a little bit more streamlined so that we're all really doing the same thing. But we want to obviously encourage using the patient passports, make sure that every family is offered one, so that you can use it as and when you feel would be helpful.
So in terms of making things a little bit more family friendly, we recognised that sometimes when we're giving families diagnoses and information, especially on genetics in clinic, it can be really hard to understand. So we tried to break that down into different forms of leaflets that are written in really easy to understand language and use lots of imagery as well. So we've rolled out leaflets for baricitinib therapy, specifically for AGS, so that families can better understand what the implications of trialling that drug is. When we were first prescribing that to patients, we were giving out a really lengthy medical jargon form, and it wasn't really very family friendly, so we decided to change that. So along with genetics information, we also have Hannah's schools leaflet, and families can either take that into schools or she'll go in and do presentations and just work with schools a little bit to help them care better for your children.
And we really want to develop more policies and guidelines so that if you go into a hospital and you're maybe out of hours and the doctors who are taking care of your child haven't heard of your child's conditions, the guidelines in their policies, who they can contact me or any of the White Matter team just to let us know that your child is coming to hospital. And then we can always just come and see you if it's local to us, and just to touch base, see if there's anything you want us to raise with the doctors or anything like that. So that's an aim. Obviously things take time, but obviously we are very keen and we do want to do things to improve things, so we will. And we really want to develop a person-centred service, which again is just standardised across the whole of the UK and the whole of the IWMD service.
It's all very well and good for us. We get very excited in Leeds, Manchester, and we really want to make a change, but we also want that change to be UK-wide. We want all of the care to be standardised for all patients. It shouldn't matter where you live, you should have X, Y, and Z, and you should have the same access and the same opportunities. So we're really, really keen on that.
Yeah. And we want to introduce some nurse-led clinics, which won't replace your consultant appointments at all, but often you may not see your consultant for a year, which is quite a long time, and a lot can happen in that time. So the nurse clinics would just sort of act in between that. So maybe every 6 months you'd come and see the nurse, discuss what's going well, maybe what's not going so well, and then I can feed that back to the consultant or your local team, and it just sort of bridges that gap for the long space of time that you might be having between seeing an IWMD consultant.
So part of what I do alongside attending clinics and inputting data and all of that sort of thing is really try and build relationships with industry and pharma and work out how can we be better informed as a service, how can we across the UK know what's coming next. And so I'm currently in the process of creating one big file, essentially, that our UK network have access to. And so along with Alex TLC, I'll be keeping that up to date in terms of what's happening in research and also what we're doing in Leeds, sharing that, because what we're doing in Leeds, Manchester, in London they might be doing something else, and having somewhere where we can all put shared information, we can all put patient leaflets so that they can be rolled out nationally, not just in our centres. Oh yes, study days. I get the pleasure of organising our annual study day. I'm very pleased to say that we're oversubscribed this year. And we hear a lot that families come and they get this diagnosis and they take that back to their local teams, their paediatricians, GPs, allied health professionals, and they don't know what it is. And it's big and it's scary. So part of what we really try to do is educate our local surrounding teams and invite them once a year to come for a study day. And that varies. So this year we have patient speakers. Alex TLC always very wonderfully come and support us and share their patient voice as well. And what we do changes year on year depending on what the local teams are telling us that they need. So this year we're very much focusing on like symptomatic management and how to empower our local paediatricians and doctors to look after your children and know that they can do that well and supporting them in that process.
I think that might be it.
That's
but
it.
we just want to say, and I know I speak for Jade as well, is that we are really, really privileged to be in the position we're in and just sharing just a part of your journey. So we do really appreciate your feedback and anything that you think we could be doing to help you. We are more than happy to hear, aren't we? And we will act on it. So if you do have any questions, just let us know.
Thank you.
So, and I want to say a special thank you. I don't know where I'd be without Hannah and Jade sometimes. And we work really well together. We work really collaboratively. And that's so important for all of the families to make sure that, we're helping everyone to get the sort of the help that they need and the care they need. Did anyone have any questions? Yeah?
Hi.
Hiya.
Do you know if there are any plans to do anything like this for adults?
So there is an adult nurse, but I believe she is finishing. But adults work very, very differently. But we do meet, and I do plan on meeting the nurse who takes over from the nurse who's leaving. And the aim is for it to be a little bit more streamlined as to what we're doing in Leeds and Manchester. But I do think the adult team, does work very, very different to the paediatric team. But in terms of support, I mean, there's definitely role for that, isn't there, Karen? And I'm sure we can.
Absolutely.
It just, the two services just work very differently. But we are going to link more so that the ideas that we're doing in Leeds and Manchester can be shared amongst the other services as well.
And I think as well, if I can just add, a lot of what we've done has been driven by what patients have told us that they need. So please speak up if there's something that you feel would be really helpful. Talk to us about it, because you're the biggest, most powerful voice for change within the service. So we really try and be led as much by families as possible. We're not living with leukodystrophy, so we can only make our best effort to provide what we think might be needed, but ultimately we need you to tell us what can we do better and what would you find useful. So yeah, that's what I'd add if that's okay.
I also think that the patient passport for adults, is crucial.
Yeah.
Because, the same happens in the adult world as happens in the paediatric world. That if you see a local consultant, they're not necessarily going to know leukodystrophy. So. And
it's really good for us to fill them out. I love filling them out because you hear so much about a family's life that often you don't get to share in clinic, like the day-to-day things that you don't always mention. And then I feel like I really get to know the families really, really well, so it would be beneficial in the adult service to have one of those as well.
There's a question just in the middle.
Hi, thanks for sharing. Do you mainly cover the north of England, or do you have counterparts down south as well?
So we just cover the north of England, but obviously, like I've said, we do have links with the whole service. So if we have an idea that's working well, we do share it amongst the other nurses. But like I say, that there is a nurse in London as well, but her white matter hours are mixed into her hours in another job, whereas this is my mate. I don't do anything else, I'm just white matter, which I do think makes a little bit of a difference. But that doesn't mean that you can't get the service wherever you're from. It just may look a little bit different.
Great, thanks. I think one of the things that you shared and mentioned, which is just a practical thing, you mentioned about joining MDT meetings and going through the actions and making sure those actions are followed up.
Yeah.
But also, you mentioned about tracking various appointments to make sure, because Seth has quite a few appointments, and I tend to build a network with secretaries, with pals, with different people, because a lot of those appointments can be routine, and if I don't chase them up, they don't tend to get booked or things get missed. So having someone like that who can fill the gaps reduces the stress for the family, but also ensures the continuity of care for the children, really. So if there was someone down south, I'd be interested to try and connect with them and get some advice from them as well and stuff.
That'd be wonderful. I mean, we do have Birmingham and the London centres that also have coordinators, and they would, I would imagine, be able to do a very similar thing. We're slightly unique in Leeds in that Lydia had a pre-existing white matter clinic, so I can very easily put all of the white matter patients in one list, and I can be really systematic about keeping on track of those patients. So it's not that the other centres can't do that, it's just that their setup's different.
Right.
But that just means that we can communicate better with what you're telling us that you would also like. Because it is important, and you've got a lot of things to keep track of, and for you to be ringing and saying, okay, this is overdue, that's not helpful, and that's not a good use of your time. So if somebody like myself can do that for you, hopefully that would take some of that pressure off.
Sure, great.
And you'd be more than, you can easily say if an appointment is better in the morning, you can definitely put that across, and that should be heard. So definitely don't feel you can't say that, because you definitely can.
Great, thank you.
I had a question as well about IVMD passport. Is it something different compared to the rare disease passport? Because I've seen that as well.
Yeah.
So is it comparative, or is it?
So it's different. It's very different, but they can be used together. The IWMD passport is very short. It's only 2 sides. It's meant to be short so that it's not too much, because we appreciate that some families may have other passports which are longer and in more detail and look at the child maybe more in, as you know, at more conditions, whereas this just focuses on the IWMD condition. So, but you can have 2. You can use them together.
Thank you.
Any more questions? Thank you so much.
Thank you.
Thank you.